When we work with patients, a big component of what we do is knowledge transfer to the patient. So as they're explaining to us what's going on and we're asking questions to further clarify what is really happening with the patient and what their needs are, they are learning in that process as we're feeding back information to them. That in and of itself gives patients a sense of empowerment.
You want to make sure that when you're looking for a naturopathic doctor or a clinic, that you have someone who is a licensed naturopathic doctor who has graduated from an accredited naturopathic school.
The most important thing when patients are looking for a clinic or a specific physician, naturopathic physician or practitioner, say of Chinese medicine or whatnot, is you want to make sure, first of all, that practitioner or physician is licensed in what they do.
In terms of a clinic, there's different varieties of clinics out there, full service clinics where they can do testing and offer a variety of therapies are optimal. So in our initial visits, or even throughout our other visits, we'll discuss, what are your dietary habits? So understanding what you're putting into your body already. What are some of the symptoms you're exhibiting? If you're having low energy, why is that? So depending on what the people's health concerns are, we'll talk about some supplements that may help improve those symptoms or fill those gaps that they're not getting from their diet.
When a patient comes to see me, the first question, of course, I ask is about what is bothering you the most. What is bothering you the most? Yeah, and we call it chief complaint in medical science.
And then in that initial visit, the naturopathic doctor and you will put together a treatment plan. So that treatment plan may include anything from changes in your diet, diagnostic testing to be done, lifestyle changes, and some supplementation may be recommended as well.
It's important that patients have as many of their pertinent health documents with them. Oftentimes we will request these prior to the visit in any case, so that we are well prepared for the visit when patients come in and we are well versed in their important health history.
Most common syndromes or questions patients have when they come to see us are stress management. I'll see a lot of digestive issues, which range again from constipation to diarrhea to bloating. Bloating is a big one. Energy levels are really low, or they feel like their hormones are out of whack. And so they have all these questions, and there's often more than just one symptom, and often those are linked together. But in an integrative clinic, we allow that, combination, or that, what's the word I'm looking for here?
Combination is good.
That combination of putting the pieces of the puzzle together versus keeping everything isolated. So our job is really to put those pieces of the puzzle together to help people find out what's really causing their symptoms versus addressing each concern on its own in an isolated fashion.
Patients of our Moody Health Center coming to Moody Health Center mainly are coming mainly for treating the side effects of cancer. And also they come here for hormone balance, immune boosting, and I have quite some patients for fertility also.
One of the first parts of our healthcare assessment involves doing a comprehensive intake with the patient to understand, first of all, what their goals are in coming to Port Moody Health and what it is they hope to achieve in working with us as physicians. And so in that initial assessment, we will often identify what further diagnostic testing or assessments we may need to do in order to further clarify the clinical picture and help that patient achieve the goals that are specific to them, but also gain some clinical insight into what are going to be the specific action items for us.
The most common conditions I see patients come into Port Moody Health with are related to digestive health, which can be anything from changes in their digestion to gas or bloating or heartburn. Stress management, so people feeling that they don't really have quite the tools they need to manage their stress levels. Low levels of energy, so people having a lot of fatigue, especially during the day and the afternoon, and that's when they need that coffee to pick them up. hormonal imbalances, which include everything from low libido to menstrual irregularities to menopausal symptoms, thyroid dysregularities, and again, stress management.
The more common health issues that we address at Port Moody Health are relating to hormone imbalance and digestive disturbances, as well as cancer diagnoses and more of the serious types of complex conditions such as autoimmune conditions, cardiovascular disease, diabetes, neurological disease. So with the level of treatments that we have to offer for patients and the broad range of expertise that we have collectively as a group, we're quite equipped to treat a lot of these difficult to treat conditions.